Welcome and good evening. Thank you for joining us for the second of our four-part Community Mental Health webinar series. My name is Keith Carson, and I am the member of the Board of Supervisors for Alameda County, representing the 5th District, which includes the cities of Albany, Berkeley, Emeryville, Piedmont, and a third of Oakland, including West Oakland. Last week, we heard from Dr. Karen Tribble, the Director of Alameda County Behavioral Care Services, and she shared with us strategies and resources to manage our own mental health. Much like the safety announcements on airplanes, we need to make sure that we are taken care of first before we can take care of anyone else around us. Tonight, we'll be diving into the topic of children and youth, and our panelists will be sharing tools and resources for you to use as caregivers. We are 1 year into living through this pandemic, and even though we are now seeing a light at the end of the tunnel, there is still some fear and uncertainty. Children are resilient, and it is our job as their caregivers to make sure that they feel safe and supported, even in these very tough times. We as caregivers, though we're struggling with burnout, as there continues to be shifting demands on us that lead to stress, anxiety, depression, layered on top of economic uncertainty. Well, this evening we will have two experts with us. Lisa Carlisle, who is the Director of Child and Youth System of Care at Alameda County Behavioral Health. Ms. Carlisle has over 20 years of experience working in education and mental health settings as an educator, mental health rehabilitation specialist, school administrator, and more recently, operational lead with the Alameda County Behavioral Health. She has been with Alameda County since 2010. Lisa is a native of Oakland and attended and graduated school at San Francisco State University, earning a master's degree in ethnic studies and also as a master's degree in educational administration. Keshia Ingram is the TAY Program Coordinator with STARS Community Services. Ms. Ingram is a clinically trained professional, a registered associate marriage and family therapist with a BS degree in criminal justice from Cal State East Bay, and an MA in counseling psychology from the University of San Francisco. She has been with the STARS Community Services for 3 years, starting as a clinician with the TAY program, advancing to lead clinician within STARS school-based services program, and in her current role as transitional age TAY Program Coordinator. Ms. Ingram has over 10 years of experience in community-based and residential settings, focusing on adult children and families in crisis, post-trauma, adolescent issues, psychosis, and parenting support. After tonight's presentation, we will have time for questions from the audience. At that time, staff will provide the directions on how to participate. I want to thank both of our panelists, Lisa and Keshia, for presenting this evening. Thank you.
So this evening we'll be joined by Lisa and Keshia, and we will have them pop on now.
Good evening, everyone, and thank you for joining us and taking some time out of your busy and demanding schedules. I'm Lisa Carlisle. I am the Director of Child and Young Adult Services with Alameda County Behavioral Health Care, and I would like to introduce Ms. Ingram.
Hi, everybody. My name is Keshia Ingram, and I am the TAY Program Coordinator for STARS Community Services.
We have prepared a presentation for you this evening, and we are going to talk about early signs and symptoms of mental health challenges with children, youth, and young adults. We're also going to spend a little bit of time talking about stress and trauma. This is a broad overview, and so we won't go into as much detail as we'd like if we had more time, but we hope to provide enough information to give you some tips and tools that you can use with yourself and your loved ones. And we will conclude with some additional resources for where you can get help and assistance as well. So we are going to begin our presentation. So our workshop objectives this evening are to increase knowledge of mental health and wellness and to introduce signs and symptoms of behavioral health challenges in mental illness in children and youth, to define stress and trauma, explore types of trauma, and to examine the impact of chronic stress and complex trauma. First, I'm going to just talk a little bit about Alameda County Behavioral Health because I don't assume that everyone knows what that is. Alameda County Behavioral Health is part of a larger managed healthcare plan, and we provide mental health and substance use disorder services to individuals in Alameda County, primarily who have full scope Medi-Cal. We are part of the larger healthcare services agency, and our sister agencies are public health, environmental health, and agency administration. Within behavioral health, we have 4 priority populations that we focus on, and that's children and youth ages 0 to 17. We have our transition age youth ages 18 to 24, our adults, which we define as ages 25 to 55, and then our older adults ages 55 and up. Now, we do have a variety of services that go across the age continuum, but our systems are typically broken down by age group. And next, we want to just talk a little bit about mental health. We want to make sure that we define it. Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. And we wanted to share just a few, just a few pieces of information about mental health disorders, what it is and what it is not. Mental illness is a condition that affects a person's thinking, feeling, behavior, or mood. These conditions deeply impact the day-to-day living and may also affect the ability to relate to others. And if you or a loved one feel that you are suffering from a mental illness, you're not alone. Mental health conditions are far more common than you think, mainly because people don't like to or are scared to talk about them. However, some interesting information: 1 in 5 adults in the US experience mental illness each year. 1 out of 20 adults experience serious mental illness each year. And 1 out of 6 youth ages 6 to 17 experience a mental health disorder this year. And 50% of all lifetime mental illnesses begins by the age of 14 and 75 by the age of 24. And that's very important to take note of because early onset of mental health disorders are at the early adolescent age, between that sweet spot of middle school and high school. And so by the time our young people become young adults, they have, for lack of a better term, grown into their mental disorders and mental health challenges, and seeking help and support becomes really critical. There's also some other factors that contribute to mental health problems, which include biological factors such as genes and brain chemistry, life experience such as trauma and abuse, and also family history of mental health problems. Now, family history isn't always a causation, but it can be a correlation to positive health outcomes. So now we want to talk a little bit about mental illness signs and symptoms, because they do look a bit different in early childhood and adolescents and young adults. We'll talk a little bit about that. Mental illness signs and symptoms. People may expect a person with serious mental illness to look visibly different from others. And we may have a tendency to say, well, this person doesn't look ill, or they can get over it, or they can will themselves through it. And those are some of the misconceptions about mental illness. Mental illness isn't something that if you could just do better, you would be better. That's not how it works. Or if you just got enough sleep, you wouldn't be so cranky. or if you exercised more, you wouldn't feel as bad. It doesn't work that way. It's not something that you can just get over, and it's not something that you can just use your willpower to get through. An additional piece is social inequality has been associated with risk of developing mental health challenges. And I wanted to make sure that we talked about that because the social inequality across spectrums adds an additional layer of stress and trauma, which can contribute to the acuity of mental health challenges and also contribute to the early onset of some of the mental health challenges that we're seeing in our children and youth. A little more about signs and symptoms. And some of the information that we're sharing is from Mental Health First Aid. And this is not an exhaustive list, and so we may not cover everything, but these are some things that are typically seen in particularly our adolescent population. And you may see this evidenced in unusually sad mood, lack of energy, isolating from friends and family, lack of interest in activities that used to be enjoyable. And I want to go back a little bit with the isolation from friends and family. There are certain times in adolescent development where isolation or separation from family is normal as youth are developing their own identity outside of their family and they're spending more time with peers. So that is normal. When the isolation from both the identity that they have come from and the identity they're becoming with their peers, when they're isolating both their friends and family, that may be cause to check in on your young person to make some determinations on whether or not something else is going on. And also lack of interest in activities that used to be enjoyable. Now, again, children and youth, they grow out of activities. Children, they may grow up playing with dolls or trucks, and by the time they're 13, they've moved on to other activities. So it's not necessarily that they are no longer engaging in activities, but if they have not picked up new activities or they are no longer engaging in something that was very important to them. For example, if you have a 12-year-old who is on a track team, and all of a sudden this young person is no longer interested in being on the track team, and there is no replacement behavior or replacement activity, that might be a sign that something else is going on. Additional things that go along with a bit of mood disorders, which we're not really going to get into, unrealistic or excessive fear or worry, that may look like extreme anxiety, decreased concentration and memory, headaches and dizziness, low self-esteem and confidence, rapid speech. And, to some extent, this may sound like every young person and teenager that you know. And one of the distinctions that we make in the field in terms of making the separation between normal adolescent development and onset of mental health challenges is if it impacts the ability of that young person or young adult to do three things: the live, laugh, and love. So it affects their ability to live their life normally and do those activities that they're used to. Laugh, which means enjoy activities, and love, have meaningful relationships. So when it starts to impact those three areas all at once, not just particularly one individually, but all three of those areas, that may go beyond the typical stages of adolescent development. And just lastly, there are 1 in every 6 children within the age group of 2 and 8 that have some other neurodevelopmental or behavioral and emotional difficulty. We won't get into a lot of the brain science here, but just know that the impact of stress and trauma and some mental illnesses do have impacts on the brain and how the brain wires and fires. And so when you're looking at your young person and you're seeing some of these challenges, you want to first try to rule out any primary health care needs. There may be some physical health challenges that can answer these questions. So we encourage you all to check with your pediatrician or your family doctor and make sure that there isn't something in a physical health perspective that's happening. And once you have gone down that route, then you may want to consult a mental health professional if you're noticing that some of these behaviors persist. What about stress? Is that a mental illness? And, you know, we go to Google for everything. So I went to Google to look to see what stress is. And it's pressure or tension exerted on a material object, a constraining force or influence, and then lastly, physical, chemical, or emotional factor that causes bodily or mental tension. Now, the American Psychological Association defines stress as an uncomfortable emotional experience accompanied by predictable biochemical, physiological, and behavior changes. And you might be thinking, what in the world does that mean? So we're going to talk about, we're going to move into some types of stress so that you are a little more clear about what stress is, what it isn't, and then the types of stress that can impact not only children and youth, but adults as well. So this is just an example of some of the things that might be stressing you out. It can be anything: homework, bill payments, challenging relationships, family dynamics, pretty much everything. And for some of us or our family, friends, and loved ones, all of these things together are stressful. And one of the things that we're experiencing during the pandemic is a concentration of stress because normal routines have been interrupted, jobs have been lost, people have succumbed to COVID-19, we have disruptions in schools. And so a lot of the daily stressors that individuals and families experience are, much more stressful during the pandemic.
And so I'm going to speak about types of stress. So we all experience stress throughout our lives. And the types of stress and the timing of the stress determine whether and how they impact us. So we have positive stress, and that's more so of starting a new job, going to school, buying a new car or a house, starting a new romantic relationship. You have tolerable stress, and that's failing a class and or not passing the exam. Auditions, interviews, tryouts that result in not making the team. And then you have toxic stress. And that's where it could be the chronic abuse or neglect, the chronic medical conditions, or prolonged incarceration. And with the prolonged incarceration, that can affect those that's incarcerated as well as their family members that's outside of it.
And we put in a little bit of information about, COVID-19, and we linked it to the types of stress. And, at the beginning of the pandemic, we may have defined the shelter in place as tolerable stress. It was something that we thought was short-lived, and, we were given 2 weeks. We were supposed to stay at home for 2 weeks, and everything was supposed to go back to normal. And when the 2 weeks came, then 3 weeks, and then 4 weeks, and then 5 months, and 6 months, 9 months, that tolerable stress moved over into what we could categorize as chronic stress because it is ongoing. And for many families, depending on their situation, the stress of the pandemic has been relentless. So we wanted to include a few pieces of information on the impact of children, youth, and young adults. Young children and adolescents during the pandemic lockdown have a greater impact on emotional and social development compared to that of adults. These children have had interrupted routines. We have some children and youth where school has been their respite, where home is not. And they are at home now without the respite of school. And that can increase stress, not only for that child, but also for their caregiver as well. Nationwide school closures have negatively impacted over 91% of the world's student population. Prolonged periods of stress could have a long-term negative impact on their development. And compared to adults, this pandemic may continue to have increased long-term adverse consequences on children and adolescents. You know, I don't know about all of you, but my house has gotten so much smaller because everyone is home all the time. I used to feel that my home had adequate space, but there's not enough space when you have multiple people trying to be on Zoom or trying to be on a computer, or you have to pause to, help your third grader with their reading assignment, or make sure that your fifth grader is logged on to math class, or make sure that your high schooler is not, off looking at videos on YouTube. And so just the concentration of families having no time apart from each other, where there's no longer a line of distinction between work, school, and home, that can be stressful. And children are feeling the stress of the parents and caregivers, as well as their own stress of being isolated from their friends and peers. So now we're going to talk a little bit about trauma. Trauma is any type of distressing event or experience that can have an impact on a person's ability to cope and function. And trauma can result in emotional, physical, and psychological harm. It comes in many shapes and forms, and trauma has no boundaries. It does not discriminate against age, gender, socioeconomic status, race, ethnicity. It doesn't discriminate against zip codes. Everyone is susceptible to trauma. There are populations that have more exposure to trauma for various reasons, but no one is exempt from trauma or the impact and effects of trauma on personality development, on psychological mental health and wellness, and also on your overall physical health. We'll talk a little bit about some of those physical health implications shortly.
So the types of trauma. There are a number of ways in which trauma is experienced. Physical and or sexual abuse, natural disasters, emotional abuse, neglect, war, terrorism, or political violence, victim and or witness to domestic violence, death of a parent, child, or caregiver, victim and or witness of bullying, historical trauma, which is multi-generational trauma experienced by a specific cultural, racial, or ethnic group, and is related to major events that oppressed a particular group of people because of their status as oppressed, such as slavery, the Holocaust, forced migration, and the violent colonization of Native Americans. You have community trauma, and this is trauma experienced by community members, and it can be an event that impacts a few people, but also has structural and social traumatic consequences. And common types of community trauma is bullying, fights among gangs and other groups, shootings in public areas such as schools and our communities. And then you have vicarious trauma. And this is an occupational challenge for people working and volunteering in the fields of victim services, law enforcement, emergency medical services, fire services, and any other allied profession due to their continuous exposure to victims of trauma and violence. Vicarious trauma is the emotional residue of exposure that counselors have from working with people as they are hearing their trauma stories and becoming witnesses to the pain, fear, and terror that the trauma survivors have endured. And thank you, Lisa.
I'm sorry, Keshia, did I move too quickly?
You did, but that's okay.
No, I can go back.
Okay. So where does trauma happen? And so just briefly, like I said before, it could be social media, neighborhoods, work, homes, schools, and churches.
I got a little overzealous with the slides. My apologies. And, essentially trauma can happen anywhere. And how do we know if someone has experienced a traumatic event? And most people at some point in their lives will experience physiological trauma. The impact of this experience varies from person to person. While many people who have experienced a traumatic event will go on with their lives without any lasting negative effects, others will have more difficulty in experience traumatic stress reactions. And I like to add analogies to this. And when you watch a movie with someone, you all watch the same movie, but you saw different things. You may pay attention to something different. You didn't notice the red car in the back of the scene, and the person you're watching it with, noticed the blue car in the front of the screen. And so just because individuals may be together and experience or witness a particular event or experience the same event does not mean that the impact of that event is the same, because it's not. Effects of experiencing traumatic events may manifest itself in nightmares and flashbacks, trouble sleeping, self-destructive behaviors, shame or self-hatred. We see a lot of shame and self-hatred with children and youth that have been abused, either physically, sexually, or emotional abuse, and blaming themselves for how the parent, caregiver, or adult in their life has treated them, and internalizing that as their fault. We can see that in young adults and adults as well. Trauma triggers. What are they? Those are the things that remind you of the traumatic event. And trauma triggers can be everywhere. And a lot of things in life can be triggering. If you are a victim of abuse, and maybe there are certain times of the day where the abuse happened, you may be triggered as those times approach your daily life. If you do not have happy memories of Thanksgiving because you have a family member that was struggling with substance abuse and they were intoxicated at every Thanksgiving and acted out violently, the idea of going to a Thanksgiving dinner in that home where you witnessed those years of abuse could be a trauma trigger just by stepping foot in the door. And so those are just some examples of trauma triggers, and anyone can be triggered anytime, anywhere. One of the things that we want to make sure we're paying attention to with children and youth is knowing the difference between, a reaction to something and a trauma trigger. Sometimes we see in our children and youth, they are triggered by things that they have not shared with us. And we may interpret that as inattitude or poor behavior, but they could be responses to traumatic events or defense mechanisms that are being employed to keep that individual safe. And so pay attention when your children and youth are having reactions to either certain situations, certain people, certain times of the day or times of the year. Anniversaries of loss can also be trauma triggers. The onset of holidays can also be trauma triggers. So pay attention to your young people if you're noticing a pattern of, well, every time we go over here, something isn't quite right. Or every time we pass, this store, something isn't quite right. Or every day around 10:45, something happens with my daughter. Pay attention to those things and ask questions. And language is important. We as adults have a tendency of saying, well, what's wrong with you? Where we can reframe that to what is happening with you right now, or what has happened to you, which is very different than saying what's wrong with you. Because when we say what's wrong, we are already visiting a negative connotation to what they are experiencing. But if we ask what's happening with you right now, that allows the young person an open door to explain what's going on. So language is very important when we're dealing with trauma also. How to manage trauma triggers. And this is just some research out of the University of Southern California, but there are other things that can be done as well. And we just talked about those just a little bit. Learn about the trauma triggers and their historic nature. Identifying specific instances where you are triggered, and how to anticipate some of those triggers, particularly in your children and youth. We're having these children and youth and young adults returning back to school. They're going back, adults are going back to work, and you're coming back into situations that you may not have been exposed to for quite some time, and they may not have been pleasurable when you were there. So as your children are going back to school and as your young people are going back to college, don't assume that they are happy to be back because isolation was so terrible. If their school experience was not a good one, them returning to school may create more stress than them staying at home. And again, every young person is different, every young adult is different, but pay attention to those reactions that your child or young person has, and make sure that you are having an appropriate response to what you're saying by asking some of those open-ended questions.
So what happens if nothing is done to address chronic stress and trauma? So a few mental and physical health issues can occur. Depression, anxiety, PTSD, post-traumatic stress disorder. You can be at a high risk of suicide. You can begin to engage in high-risk behaviors, develop high blood pressure, a heart disease. Alcohol and substance abuse is really big, especially among our young people. And a stroke can also occur.
And one of the things that's important to understand about the physical implications is that these chronic conditions, as they impact your physical health, they take a toll on your life trajectory as well. And so chronic stress and trauma can make more acute that high blood pressure and can increase heart disease. So pay attention to the physical components that you might be seeing in your children, youth, and young adults also.
And here go a few strategies for self-care. Seek professional help. Make your wellness and recovery a priority. If you don't, no one else will either. Do things that you enjoy, that are positive and safe. Set limits to manage expectations. This means with your spouse, children, family, and friends. While stress is a part of life, setting limits can lower the instances of chronic stress. This is a big one. It's okay to say no. You don't have to always participate in those social and family events with peers, with family, just because of the setting. If it's triggering to you, say no. Just breathe. Sometimes we just need to pause and take a breath, go outside, come back in, and just regain control of the horse. Get some air, take a walk, take the kids to the park, go walk Lake Merritt, Lake Chabot, do something that you enjoy and get outside. And also take some time to reflect. Meditation, prayer, write in a journal. Take the opportunity to reflect on your health and wellness journey.
Keshia, you are on mute.
Thank you, Amy. So tips for your improved health and wellness. Mobilize a support system, reach out and connect with others. Talk about your traumatic experience with people who will listen and have a good listening ear. Cry again, and then cry some more. Work out, do exercises like jogging, bicycling, walking, relaxation exercises, yoga, going to get a massage, stretching, humor, laugh. watch a funny video or a movie, and take good hot baths.
Music and art is another way to improve your health and wellness. Maintaining a balanced diet and regular sleep as much as possible. Avoid using stimulants such as caffeine, sugar, and nicotine. Commitment to something personally meaningful and important every day. Small goal setting. Hug those you love, and pets are included. Proactive responses toward personal and community safety. Organize or do something socially active. And write about your experience in detail, just for yourself or to share with others. And lastly, and probably most important, where can I get help for myself or someone else? We didn't talk a lot about it, but suicide prevention is very important. And if you or your loved one or young person are having troubles or thoughts of suicide, there is help available. And we have provided the suicide hotline for you to use. There are also text lines available as well. We have provided the National Alliance for Mental Health helpline, which is an 800 number that's available. We have our Family Education and Resource Center, the FERC, which is located in Oakland. And that is an organization run by the Mental Health Association of Alameda County. And it has professional mental health professionals, as well as family and caregivers that can provide peer and family support with their lived experience so that you can be a better support for your loved one or for yourself. We have our Crisis Support Services of Alameda County that has a 24-hour crisis line. Our Alameda County Trauma Informed Care. We also have our pool of consumer champions, which is our facet in Alameda County, where we have individuals with lived experience that can support and advocate for you or your loved ones and their mental health challenges. And if you don't know where to start, you can contact your healthcare provider, depending on what type of insurance you have, and get help there. And for those members of Alameda County that have Medi-Cal as their health insurance, we have our Alameda County Access Line, which is a toll-free number where you can call and discuss with our highly trained staff what some of your needs are for children, youth, and adults for mental health and substance use disorder services, and receive triage and referral. I'm going to leave this one up a little bit. Our last slide just says thank you and ask for questions. So we are open and available to answer any questions. I'm going to pivot over to Amy for that piece of facilitation, but thank you for having us, and we are ready to answer any questions or respond to any comments that you all may have. Thank you for your time.
So if you would like to ask a question, you can either post it in the Q&A box, and I will ask it to our panelists, or you can raise your hand to ask your question live. If you're on the phone, you can ask a question by pressing *6 to raise your hand and unmute your mic. So we will start with our first raised hand, which is Julie Tang. Julie, you're on the line. You'll need to unmute your mic. Julie Ting.
Hi, you know what? I actually accidentally pressed it.
No problem.
Okay, thank you.
Our next question is from Cheryl Davila. Cheryl, you're on the line.
Thank you, and thank you for this today. It's been great. I was just curious as if the traumas and triggers don't get addressed, in childhood, or maybe they appeared in some time throughout your life, and you're perhaps a senior, then what? Are they still able to deal with their triggers and or traumas? I was just wanted to ask you to speak to that.
That's a very good question. I want to start with saying that intervention and treatment is across the age spectrum, from childhood into our seniors. And we may have experience with our senior population where the trauma is not recognized until they're well into their adulthoods. And it's not too late. So if you are working with a senior member of your family and you're noticing some of these behaviors, you can also ask the same question that you would ask a child or youth. What's happening with you right now? What's going on with you? Again, which is very different than, Grandma, what's wrong with you? A different approach is, Grandma, what's happening with you? And one of the things that's important to know about trauma is that sometimes trauma is not remembered. And we may have experience with family members or loved ones or even ourselves where our brain's protective factor has blocked out the trauma, but we are still triggered by something that we cannot explain. And if you or your loved one are feeling that there is some either undiscovered trauma or some trauma that you're not, that you don't know how to really deal with or address, you can really reach out to seeking professional help. And starting with the senior's primary care physician, because with older adults, we also, deal with memory loss. We also deal with dementia and Alzheimer's, which could bring up things that were forgotten, or it could be part of the things that are happening physically because of the onset of dementia or Alzheimer's. I hope I answered your question a bit, but the strategies really aren't that different across the age groups. It's paying attention to some of those triggers and asking some of those questions and really understanding that recovery is available at any age.
Thanks, Lisa. So we had a question in the chat. What about community members who may be undocumented or don't have health insurance?
Great question. So I'm going to talk specifically about what happens in Alameda County because I am not well versed in what other jurisdictions do or what they have available. There are a number of programs and services available through Alameda County Behavioral Health, as well as with some of our community providers that support our undocumented population and also our unaccompanied immigrant youth. And, immigration status is, it may feel like a barrier, and at sometimes in some venues it is, but that should not be a deterrent for getting treatment. And if you're unsure about how to get services, call, and I still have the screen up, call the Alameda County Access Line at 1-800-499-9099 and make those inquiries, because that team can direct you to the appropriate service and service provider that can support those populations as well.
As a reminder, if you'd like to ask your question live, you can raise your hand and we'll unmute your mic so you can ask your question live. Our next question comes from the Q&A, and it says, how do we get adult children help when they don't think anything is wrong?
I think Keshia and I are going to tag team on this one. There is a distinction with children and adults in terms of what we have permission to do and what we don't have permission to do. Of course, under 18, we can, as parents and caregivers, consent for treatment with our children or young people, bring them to appointments. Now they can refuse and they can go to the appointments and not participate, but we do have some agency in being able to do that. Once they become 18 and over, it becomes more challenging, particularly if the early signs and symptoms weren't recognized at age 13, 14, and 15, and now they're 24, 25. You have a 10-year time span of the settling in of that mental health challenge that has been untreated. And now we're coming in at age 25, 35, 40, dealing with what is now a severe mental illness. And what happens with individuals that are operating in their symptoms, it has become normalized to them as who they are and how they operate. So to get them to see that it is a mental health challenge, that is a challenge. I'm going to pivot to Ms. Ingram because she has certainly some insight on that young adult population and dealing with those adult children.
Yes. The adult children that do have mental health issues, it's a lot that don't think nothing is wrong with them. And they come in and they'll agree to services, but they'll be ambivalent about what they want to do and what they don't want to do. And so I think right now, just having a talk with the adult children about seeking help, and it could just be a conversation with calling the access line and just talking about anything that they have going on and seeing about a referral, because it's okay to get referred to a program and then not follow through. You can go, you can get the answers that you need, find out how a program can help, and just decide on if that would be appropriate for you and the family. The adult children do have the right to their own treatment. So if the adult child says, no, this is not what I want, the agency will go with that. But I think it's good that you should have a talk with the family member first and then link them to appropriate services if that's something that they would like to do.
Thanks, Keshia. Our next question is, how can we support youth that may show signs of mental health problems, but also might be using drugs to cope with symptoms?
That is a very good question. And we're going to tag team on this because it can get really complicated really quickly. And, the substance use is oftentimes a byproduct of treating a mental health challenge or an unhealthy coping strategy. And so with SUD treatment, which is a more specialized service because you have to deal with the addiction and then also the underlying mental health condition or stress or trauma that substance is treating, and it can become very challenging. There are specific strategies for alcohol abuse, opioid abuse that are very distinct from traditional, what we call talk therapy or talk psychotherapy. There are different strategies that include harm reduction, and then there's also complete abstinence. And so depending on where a person is in their wellness and recovery journey, that can dictate which strategy is the best use. And we know that we are seeing a great increase in opioid use and or abuse, I should say, and fentanyl abuse. And we know that opioid treatment is medication assisted treatment. So as individuals are no longer using those controlled substances, the treatment is also medication supported. And so with the physical health component of dealing with the body's withdrawals, which are very real, and dealing with whatever the mental health challenges are under that, and then also trying to create conditions where that individual can be successful is key. And by successful, I mean having peer groups, having support groups, and having a support circle, particularly for our children and youth and adults that are struggling with substance use, having a support system is really key to recovery and decreasing the instances of relapse. I'm going to mute myself so Ms. Ingram can speak as well.
Yeah, I've seen this a lot throughout the STARS agency with clients who use drugs to cope with their systems as well as trying to improve their mental health. And I think that you come in and you start where the client is, you know, because you don't want to come in and suggest that a client should just stop with their drug usage, because that's what they're using to cope in managing their symptoms. But you do want to get to a point to where you're helping that individual manage their mental health, improve their mental health, and slowly start to decrease that drugs. You finding alternatives to the drugs and giving them different coping strategies to manage whatever issues that they have going on. So linking them to the appropriate services, like Lisa said, you know, if it's an AA, if it's a drug rehab, you know, whatever it is that they need, maybe a medical doctor, you want to support them throughout that time to find alternatives for their stress.
Absolutely. And just one last note on substance use disorders. You know, just like Ms. Ingram said, there has to be a replacement strategy or replacement behavior. You can't just remove the substance and expect that individual to be able to cope. You have to give them coping skills and strategies to replace the substance use. And sometimes that's hard because we want our loved ones to be able to just stop. But if they don't have the appropriate replacement behaviors and appropriate coping strategies, the drug use will continue even if someone is in treatment. So don't just assume that someone that's in treatment, which is very different than detox. I'm not talking about detox. I'm talking about on an outpatient model. There may still be some use in treatment until that individual and their treatment team has come up with appropriate coping strategies and replacement behaviors, where whatever that thing is that comes up in that individual, where they want to go to that substance, they now go to this strategy, or maybe go to this person, or go to this activity.
Thank you. Our next question is, well, I can answer this one. The presentation will be available on Supervisor Carson's YouTube page, and we will send it out to all attendees once we it's all loaded up there. And we can also share the presentation as well. Our next question is from Pastor Phyllis Scott. You can unmute your mic, Pastor Scott, and ask your question.
Thank you for this presentation. It was very knowledgeable and easy to understand. I have a question. We spoke a lot earlier about adults that are having challenges and they don't recognize that they're having challenges. And eventually, have you noticed that those challenges can affect the family, can affect the people that are around them, that are trying to encourage them to get help, that are trying to explain to them how their behavior affects them? I've noticed in my time in pastoring that it affects the family, it affects the caregiver, it makes the family somewhat codependent. And would you suggest that if it's possible that those family members or separate themselves or get their own individual counseling so that they can better cope and not become challenged themselves through what they're going through with their loved ones or family members?
That's a great question, and Ms. Ingram and I will tag team on this, but you know, there is no one answer that I can give for that because the scenarios are so different. And, you know, yes, when someone, particularly adults or adult children or adult family members are living in their symptoms, it causes extra stress and trauma on the family. And, you know, you're trying to get a person into treatment, or you're trying to get them to recognize that there's something going on with them. And it's very stressful, and it can tear families apart. It can further isolate not only that individual, but that family. You don't want to go to events anymore because you know everybody's going to talk about your mentally ill aunt and ask you, how is Auntie Lisa doing? You don't want to have that conversation. So not only is that individual become isolated, but so does that family. And we do encourage for family members and caregivers and those that are close to the individual that has the mental health challenges, they are not exempt from also suffering from some depression and anxiety because of their care for that loved one. So we absolutely encourage family caregivers and loved one to get their own professional help. Now, this is not to say that they too now have a mental illness, but it's stressful and they need to be able to talk to someone about that professionally, or they may want to contact the Family Education Resource Center and join one of those family and caregiver groups. But, you know, I've been doing this a long time, and, you know, it can be heartbreaking for families to watch their loved one deteriorate and feel helpless to do anything about it. And that helplessness can take a toll on that family member. And Pastor, your other part of that question was, should they isolate or should they distance themselves? And that's very situational. We have some individuals where how they're operating in their mental illness is a danger to their family and their loved ones. And in those situations, there may be a separation that needs to happen. But again, always seek support. You know, try to get support for yourself and your loved one so that you can also have strategies for self-care, because that also brings up what Ms. Ingram was talking about earlier, that vicarious trauma. You are experiencing the trauma of watching your loved one suffer through their mental illness and not being able to help them. That's stressful and traumatic. So there isn't a one size fits all, but definitely families and caregivers should also be seeking help and support for themselves, not just their loved one.
Yeah, I would just add on, Pastor, you know, having a good self-care practice would be good. Supporting the individual as much as possible that you can tolerate. And as well as if you can't go and get your own help with, you know, going to therapy, I would join a family support group with other families and our parents that have the same situations that you're dealing with, and just having a more open discussion about what's going on and how to get support.
Thanks, Keshia. If you both have a couple more minutes, and we have just a few more questions in the Q&A box to wrap up. Does that work?
Yes.
Okay.
We're good on time.
Are there county-provided mental health supports for nonprofits that work frontline with the community?
I'm not sure I understand the question. Are there?
I think maybe, are there resources for people who are providers in the community, like mental health resources for people that are working, you know, with the community?
Yes, you know, and that's a twofold, you know, answer. And, you know, the helpers need help, right? But the helpers aren't good at asking for help. We're not good at that. We're good at taking care of other people and then, you know, sucking it up ourselves. And while help is available and we encourage it to our clients and our families, it's I don't want to say it can be challenging to visit that same advice and strategies upon ourselves. And so again, there is no roadblock for those that are doing the frontline work to receive services. Now, a number of our partner agencies have health insurance connected to those positions and have access in some instances to the same network that we provide for our clients. What I have found over the years is that, you know, mental health is a small world, and sometimes the practitioners seek support, you know, over in the next county so that they don't run into a colleague in treatment, or go to an agency that knows them, because we too are not exempt from feeling doing the work and then feeling stigma for getting the very services that we provide. But help and support is available not only for the community, but also for the agencies that are providing the work. And if they're not sure where to get that support, they can contact the respective systems, either myself, if it's a child or young adult provider. We also have our crisis services that's run by Ms. Stephanie Lewis, and then also our adult services overseen by Ms. Kate Jones as well. So help is available across the spectrum and across the disciplines.
Thank you. Another question, how do you recognize triggers versus trauma?
Well, trauma is the event. The trigger is a byproduct of the event. And we talked a little earlier about, how people experience trauma. And, Miss Ingram and I can be in the same situation, and I feel traumatized by it, and she doesn't. By traumatized, meaning that I have a physiological reaction to it. My heartbeat races, my palms are sweaty. I have a fight or flight response. I'm dreaming about it. Every time I think about that situation, I go back to that very moment. And every time I pass that street corner where we were in that car accident, I flinch a little bit. So, the trauma is the event or series of events. The trigger is the byproduct of that, event. When I was younger, I had 4 car accidents by the time I was 22. And for years, every time I would see brake lights in front of me, I was socially distancing on the freeway, 6 cars, ahead, and I would pump my brakes. Or anytime I saw someone getting too close to my bumper, I would do this. That was my trigger. Seeing brake lights or seeing someone in my rearview mirror, that was my trigger. But the trauma was the 4 car accidents. So there's a distinction. The trauma is the event. The trigger is the byproduct of the event.
Thank you. Can you offer strategies for encouraging young people to help or talk to someone when they're isolating or resistant?
Ms. Ingram?
Yeah. So I think the first part, is try to get them out, just checking in with them daily, a few times out the day if they're just in the house. How you doing? You want to go stand outside on the porch or in the backyard, just slowly starting to get them removed from their location. I will slowly bring it up to, let's go for a walk around the block. Or if the mailbox is down the street, can you walk and go get the mail and come back? If you have a pet, can you take the dog out for a walk? You just want to give them extra options to get out the house, and just having communication. That's the biggest part, is just talking to them and seeing what they need. Because maybe they'll say, like, I just want somebody to talk to. And maybe you can just go walk and talk to where they don't have to make eye contact with you to talk. Maybe they want to go outside to go smoke a cigarette and they don't want to feel ashamed about wanting to be outside and smoking a cigarette. Go outside and smoke a cigarette. And so you just want to encourage them and just do it slowly. Find what they like. If it's a basketball game and you got a basketball, go to a park and shoot some basketball hoops and see how they like that for 5 or 10 minutes. You definitely don't have to have somebody who's isolating and being outside for longer than their comfort level is. So you definitely want to start it off as a slow time and then slowly go up.
Thank you. That was all of our questions. I want to thank both Keshia and Lisa for being with us tonight, and also for all of you for joining us tonight. We will post the recorded webinar on our YouTube page and send a link out to all of the participants who joined us tonight, along with the presentation. And I hope that you'll join us next Thursday evening April 22nd for our presentation about crisis intervention and supporting the people around you. We'll be joined by Dr. Erin Chapman, the Alameda County Behavioral Health Chief Medical Officer, and Stephanie Lewis, who's our Crisis Services Director, to talk about ways that tools that you can use to help someone in crisis. So we hope that you'll join us next week. Thank you all. Thank you, Lisa and Keshia, and everyone have a good evening.
Thank you all. Take care. Bye-bye.
Good night.